of birth?
Arena McDermott, 12/24/2004.
Perfect. And can you tell me why you're here today?
Just a checkup.
Perfect. And your vitals and weight and height were taken before coming back, right?
Yeah.
Perfect. Do you have any known allergies to medications or anything?
No.
Perfect. Just by looking at you, your appearance looks good, your posture, you're well groomed. Can you tell me who our last president was?
5.
Perfect. And what season are we in right now?
Late summer.
Perfect. You're dressed appropriately for that. I don't hear any speech impediment. Do you have any hearing issues or anything like that?
No.
Perfect. Before we get started, is there anything else that I need to know?
No, I don't think so.
Perfect. Okay, we're gonna start. Actually, while you're here today, we're gonna give you a head to toe assessment. We're gonna start at the head and at the toes, and I'm gonna ask you some questions. We're gonna be listening to some things like that. Do you have any questions before we get started?
No.
Perfect. So we're gonna start with the head. Right now, we're just gonna be inspecting for any bruising, distension, lesions, redness. The skin looks good and equal. We're now going to palpate. We're just going to make sure there's no bumps, no lice, no white patches. Everything looks good. Any pain there?
Mm-mm.
Perfect. I'm going to actually have you take off your glasses for this next part. All right, I'm just going to inspect your face and the symmetry. Skin looks good. I'm going to palpate your lacrimal glands. Does that feel okay?
Mm-hmm.
Perfect. And then I'm going to palpate your sinuses. Any pain there?
No.
Perfect. Then I'm also going to have you open your jaw, close, clench down for me. Perfect. Any pain there?
Mm-mm.
Perfect. All right. I'm going to actually have you close your eyes, and then I'm going to swab this cotton on your cheek. Just let me know if you can feel it, okay?
Yeah.
Perfect.
Yep.
Perfect. I'm also going to have you smile for me. Frown. Perfect. Can you swallow? Any trouble with that?
Mm-mm.
Perfect. I'm going to have you close your eyes really tight and open them really bright. Perfect. Okay. We're now going to do your eyes. Just by looking at them, there's no dryness, no swelling. Your sclera is nice and white. We're going to check for symmetry. Your eyebrows are good. Eyes are good. Eyebrow hair and eyelashes are evenly distributed. I'm going to have you look straight over my shoulder. I'm going to shine a light in your eyes. Perfect. Perfect. Pupils dilated to the light correctly. Do you have any vision problems, anything like that?
Just the glasses.
How long have you been wearing glasses for?
10 years.
Perfect. Okay. I'm going to have you follow the tip of my pen. Perfect. I didn't see any extra movement there. I don't see any. Oh, we're actually going to do some tests, actually. We're going to have you hold this like a book. I'm going to have you read the last line you can see.
374250.
Perfect. Okay, I'm also going to have you stand against the wall over there. And then I'm going to have you read the last line that you can see.
FELOPZD.
Perfect. And then cover one eye and do it again.
DEFPOTEC.
Perfect. And then I'm going to have you cover the next eye and do it again.
DEFPOTEC.
Perfect. Okay. I'm going to have you take a seat again. Everything looks good and okay with your eyes. We're now going to move on to your ears. Do you have any hearing issues or anything like that?
No.
Any pain, discomfort?
No.
Any drainage that you've noticed or anything like that?
No.
Perfect. Right now we're just going to inspect for symmetry and for redness and swelling and discharge. I don't see any of that, so everything looks good. I am going to palpate your ears. Please let me know if there's any pain or discomfort. Is that okay?
Yeah.
Perfect. We're going to do the other side. Any pain or discomfort?
No.
Perfect. I'm now going to shine a light just to see if I can see any earwax, anything like that. Everything looks good, no redness. We're going to do the other side. Perfect. Everything looks good on that side too. We're now going to do a whisper test. I'm going to whisper on each side of your ears, and you're going to tell me what you hear, okay?
Okay. Apple.
Perfect.
Banana.
Perfect. Okay, everything looks good with your ears. We're now going to move on to your nose. Do you have any problems with your nose, smelling, anything like that?
No.
Have you had any surgeries?
Mm-mm.
Have you ever broken your nose?
No.
Perfect. Okay. I'll have you take off your glasses just so I can kind of see the symmetry of it. Everything looks good. It's all straight. I'm gonna have you look up. No drainage, no blockage, no redness. Okay, I'm gonna have you go like this on one side of your nose and breathe in. And now the other. Perfect. Any problems with that?
No.
Perfect. I am gonna do one more test to test your cranial nerves. I'm gonna close your eyes, have you close your eyes, and then you're gonna tell me what you smell, okay?
Oranges.
Perfect. That's correct. Okay, now that we've done your nose, we're now gonna move on to your mouth.
Okay.
And just by inspecting it, your lips are good, nice color. Your lips are moist, no dryness. Do you have any pain or anything going on in your mouth?
No.
Any surgeries?
I've had my wisdom teeth out
Perfect. How long ago was that?
4 years ago.
Any complications with that?
No.
Do you have dentures or any broken teeth?
No.
Perfect. I am going to have you open your mouth and say ah. Perfect. Gums are pink. No broken teeth. No receding gums. No blood. No white patches on tongue. Perfect. Everything looks good in there. Can I have you say light, tight, dynamite for me?
Light, tight, dynamite.
Perfect. And then we're also going to have you smile. Perfect. And then I'm just trying to think if there's anything else that I need you to do. No, I don't think that's it. Okay, we're now going to move on to your neck. Have you had any issues or anything like that with your neck?
Mm-mm.
Any surgery or anything?
No.
Perfect. Right now we're just going to inspect. By looking at it, your neck looks good. The color is even, no bruising, no swelling, no redness. Your trachea is midline. I am going to palpate your lymph nodes for any swelling or tenderness. Please let me know if you feel anything. Any tenderness with that?
No.
Perfect. I am going to palpate your trachea. Any thyroid problems?
No.
Perfect. Okay. I am going to palpate for your carotid arteries. Perfect. Perfect. Both are strong bilaterally. I'm also going to look for jugular vein distension. I'm going to have you turn your neck. Perfect. Into the other side. Perfect. Okay, we're going to do some more range of motion exercises. I'm going to have you put your chin down, then up. Any pain with that?
No.
Perfect. I am going to have you shrug your shoulders. Any pain with that?
No.
Perfect. I'm now going to listen to your carotid artery. Just to make sure there's no bruise or anything like that, okay?
Okay.
Perfect. I didn't hear any abnormal things there. Before we move on, can I have you stick your tongue out straight? Perfect. Okay. Now that we've done your neck, we're now going to move on to your back. Have you had any back surgeries, any problems with your back or anything like that?
No.
Perfect. We're going to look at your back from two different sides. We're going to look from the lateral side. Look for kyphosis or anything like that. I don't see anything. Back looks good. Any scoliosis or anything like that?
No.
Everything is symmetrical and even. I am going to palpate down your spine. Please let me know if it is tender or anything, okay? Any pain right there?
No.
Perfect. Have you had any kidney problems, kidney infections, kidney stones?
No.
Perfect. I am going to percuss down here. Just let me know if it hurts, okay?
No.
Okay. Next side.
No.
Perfect. I am going to check for thoracic expansion. I'm going to place my hands on your back, and you're going to take a deep breath in and deep breath out. Perfect. Everything looks good there. We are now going to move on to your chest. Just by looking at it, everything is symmetrical. Your skin is an even color. We're going to check your turgor to see if there's any dehydration or tenting. Nope, looks good. Looks good, no redness or anything. Have you had any chest pains or anything like that recently?
No.
Perfect. I am going to be listening to your heart in 5 different places. On the 5th one, I am going to be listening for a full minute, okay?
Okay.
So when I stop there, don't be concerned or anything. It's normal.
Okay.
And then just breathe normally for me. Okay, and this is the spot I am gonna be listening for 1 full minute, okay?
Okay.
Okay, perfect. Everything sounded good. Your breathing rhythm is in normal values. I can't remember if I asked you this or not, but can you say tight, light, tight, dynamite for me?
Light, tight, dynamite.
Perfect. And then can you remember that for at the end of the sentence? I am going to ask you again to repeat those words.
Okay.
Perfect. Okay, now that we've done that, we're going to move on to your lungs. Do you have any lung disease or anything like that?
No.
Family history of that?
No.
Are you a smoker?
No.
Perfect. That's good. Okay, I am going to be listening to your lungs in 26 different spots. Every time I move my stethoscope, please just take a deep breath in and out. And if you need to slow down, let me know, okay?
Okay.
We're going to be doing 8 on the front, 8 on the sides, and 10 on the back.
Okay.
Perfect, and we're going to do the sides. Perfect. Everything sounded good there. I'm just now going to listen from the back. Again, take deep breaths in and out when I move my stethoscope, and let me know if you need to slow down.
Okay.
Perfect. Everything sounded clear. Nothing to be worried about there. Now that we've done the lungs, we're now going to move on to your upper extremities. Do you have any pain with your arms or anything with range of motion?
No.
Perfect. I'm going to have you lift up. Perfect. I'm just going to inspect your arms. Skin is evenly colored. No redness, no bruising, no lesions. I am going to palpate for moisture and texture and temperature. Hands are warm bilaterally on both sides. I'm going to look at your hands. No clubbing. Fingernails are good. We're going to check cap refill. Less than 2 seconds. Perfect. We're going to do some range of motions with your arms. Can you stick them out in front of me? Flip your wrists. Move your wrists. Go out. Go up. Any pain or discomfort with that?
No.
Perfect. We're going to do some strength tests. I'm going to have you push down on my hands. Okay, push up. And squeeze. Perfect. I am now going to palpate your radial pulses. Perfect. Strong bilateral on each side. Now that we've done that, we're now gonna do your abdomen. Can I have you lay back?
Yep.
Perfect. Okay, would you say you have any digestion problems or anything like that?
No.
Perfect. When was your last bowel movement?
This morning.
Perfect. I am gonna raise the bed up just a little bit. Okay. I am gonna be listening to all four quadrants for bowel sounds. If I don't hear anything in the first one, I will have to listen for 5 minutes, but I will let you know if I have to do that, okay?
Okay.
Okay, perfect. I heard all sounds in all four quadrants. Now that we're here, I'm just gonna listen to your abdominal aorta for breathing, okay?
Okay.
Okay, everything sounds good there. I am gonna palpate your abdomen in all four quadrants for any tenderness or pain. Can you let me know if you feel anything like that, okay?
Okay.
Any pain or discomfort?
No.
Perfect. Okay, now that we've done that, we're going to move down to your lower extremities. Can I have you pull your pant legs up just a little bit?
Yeah.
Perfect. Inspecting your skin, the color looks good. It's even. It looks like there's no edema, no redness, no lesions, no bruising. Okay, I'm gonna palpate your skin for temperature and moisture. Legs are worn bilaterally. We're gonna check capillary refill. Everything looks good. Less than 2 seconds. I am gonna listen to your pulses, okay? Just gonna start with the one behind your knee. Perfect. Listen to this one. Last one. Perfect. All pulses were strong and equal bilateral. We are now going to do some range of motion, okay? I'm going to have you point your toes to the wall, bring them up, roll your ankles. Any pain with that?
No.
Okay, I'm going to have you bring this leg out, bring it back in, bring your knee to your chest.
Yeah.
Any pain with that?
No.
Okay, I'm going to have you do the exact same thing on the other leg. Any pain or discomfort?
No.
No. Perfect. I am going to check for edema really quick. No edema. I'm going to have you bring your foot to your shin. Perfect. I am going to do some strength tests. So I'm going to have you push up, push down, push up. Perfect. Push up, push down. Perfect. Okay. I can have you sit back up and rotate. We're gonna do a little bit more tests, just to test your nervous system and things like that. We're gonna do your reflexes first. I'm gonna have you give me your arm and just relax. Have you bend it just a little bit, like that. Perfect. Let's do this other side. Just relax. Perfect. Okay, we're now going to do your bicep one. I'm going to have you flex your bicep a little bit. Perfect. Now relax. Perfect. Same thing on the side. Kind of flex a little bit. Now relax. Perfect. Okay, I'm going to have you scoot up on the bed just a little bit so your feet are dangling. Now I'm going to do perfect. Okay, I'm going to have you stand, get off the bed, turn around and put one knee up. Perfect. Perfect. And and then same thing. Perfect. Okay, you can take a seat. We're now going to do sharp and dull. I'm going to just touch you around your body. This is sharp, this is dull, and then tell me what you feel, okay? I'm going to have you close your eyes.
Sharp. Dull. Sharp. Dull. Sharp. Dull.
Perfect. Okay, we're now going to do the vibration test. Just tell me if you can feel the vibration or not, okay?
Okay. Yeah. Yeah. Yep. 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 Yep.
Perfect. Okay, I'm now going to check your gait. I'm going to have you stand up and then go to this wall. And then I'm going to have you walk from this wall to that wall. Normal. Perfect. Everything looks good. Now on the way back, I want you to walk heel to toe. Perfect. Okay, I'm going to have you face me, close your eyes, and just stand as still as you can. Perfect. Okay, we're going to do some fine motor skills. I'm going to have you put your arms up, close your eyes, and touch your thumb to each of your fingers. Perfect. Okay, and then I'm going to have you go like this, touch your nose, and then touch my hand. Other hand. Perfect. Okay, you can take a seat. Okay, that is it with our assessment. Can you tell me the 3 words I told you to remember?
Light, tight, dynamite.
Perfect. Okay, are you comfortable? Do you
Yep.
need anything else?
Nope.
Okay, here's your call light.
Thank you.
I will go and let the provider know that you are ready, and I will document.
Okay.
Thank you.
Thank you.